Probably not.
Okay, you want it up, didn't you?
Yeah, close enough.
Kind of close. That's good. Just
Good enough.
bring this. And just center her, because she moved around a little bit.
I don't know how to center her.
Well, just she moved.
Oh, you mean the table?
Yeah, she kind of moved out of position there.
Okay.
All right, and just make sure we got our marker. We probably want a little bit more, open up a little bit, and lengthwise a little bit.
Too much?
No, I mean, that's good. Okay, there we go. Okay, so this one's pretty easy. I think this is the easier of two faucet views, so if you have a choice when you're doing them, and again, make sure you shield, if you ever get to do this one. I would do this one, but I think it's easier. Get a nice straight tube. Patient is going to be more comfortable for them than on their knees. Okay. All right. So next one, home blood. Okay.
Is there any angle on the camphanometry?
Oh yeah, we didn't do the angle. I thought it was the same angle as whatever she was.
Oh no, you forgot. It's the angle to match the leg.
Okay, girl, lay back down. You totally didn't do that right. Get back into your position.
Oh, it's all like in
Sit
the.
down.
I was in the Sedagast mode.
No, you good, Jim. Just
Okay, good.
set that right there.
So I was thinking, wait, which is the one where you? Okay, so you can bring this all the way down. Oh. Actually, let me take that off. Just kind of make sure your face. That looks pretty close, matching, right?
Okay. And then just bring it out to 40.
Yeah. So let's kind of get it centered where we want it to. And then just bring it out to 40. You might have to bring it back.
Some more.
Yeah, come back this way. Oh, stop. Wait. Because now, all right, yeah, there. And then,
Oh, we're both moving at the same time. Okay.
so you can just move the table. Oh, well, actually, we probably can't move the table because now it's going to happen. It's going to be all the way down there. Scoot up this way. This is one of those ones that because we have such an angle on this one, you want to start your patient up this way.
Like that.
So start with the table all the way out?
Yeah.
Or patient?
Well,
Which one?
have the patient up that way, and you're definitely going to want this all the way down, and you're definitely going to want that down that
All
way.
the way down.
Okay, so let's
I'm not
see.
gonna remember
Okay, so I need to bring this back to where we're centered. Okay, and now move your patient into it, because then you know you're centered, you're the right distance, at the right angle. Okay.
And over just to
Yeah, let's get her centered right, kind of right there. Yeah. Kind of the spot where, like, they probably want to kick you for touching that spot. There. Now we're done. Yay!
Now we got it.
Now we got it. Okay.
all right.
Okay.
So the next
Now we
one.
get this straightened out one. Okay. So basically, what you're going to do is, before they get on their knees, get your tube and your cassettes lined up and get your 40 inches. Okay? So get everything lined up. Make sure your sit is correct. Okay, good. Line your tube up.
This one doesn't have an angle.
No angle.
Okay.
The patient's going to be the angle. Okay. So that's why you get all this done. You even can have like your collimation done on this one, which pretty much maybe you give yourself a little more room. So this way. There we go. Okay.
I'll refix it.
Okay.
So
All right. So now, how your patient? Oh, we gotta get this stuff out of the way. We wouldn't have this here because wouldn't
Get
have
on
just
the
on the other
force.
one. Okay. And just lean forward a little bit. Okay, so all that set. So now all you do is float the table and get it to where you want it.
The Papa too, right?
Uh-huh. Okay. Make sure you have a marker on there.
Right there?
Yep, that's good. And again, try and be as quick as you can on this one. I know this one's not as easy. This collimator is like a little trickier to use, so just get as close.
That's
on
good
this
enough.
one, okay? Good, perfect.
Any angle? No?
Patience the
Straight in.
angle. Her,
Okay.
she's making the angle right now, so you go straight in on this one. Okay, that's why you get this all set, everything set up, collimate pretty close to where you think you're going to be. Last thing you do is have your patient get on their knees, and then you just, all you have to do is float the table into the right spot and done, and then okay, you tell your patient to relax. Okay. Okay. Now, you want to see it on the chair version? Yes, no, just for grins and giggles. Maybe after we're done. We'll do the femur. We'll get to the femur. Okay. Okay. Turn around.
Which femur? Proximal, distal?
Distal AP. Or distal,
Yes,
yeah.
AP,
Distal
AP distal.
And we do that with a 14 by 5, thank you, for instance.
Still Bucky, right? We're doing everything Bucky?
Everything Bucky. The only one that's not Bucky is the Info Superior Setagas, or not Setagas, Sunrise.
Lengthwise, right?
Uh-huh. And if we do the Homeblad one in the chair. Because obviously we don't have chairs with Buckies.
That'll be next year.
Wait, we're doing
something.
we're doing proximal, right?
I think we're doing
AP,
distal.
AP,
Distal's
distal.
Distal. So it needs to be. This
2
needs to be
inches?
2
Okay,
inches.
it's below that.
So here's the bottom.
Right there. Just line that up.
So look right. I
Good.
think.
Okay. And now with her, see, like, wouldn't it be like ridiculous to do another 14 by 17 to get the top
Right.
of this? So you just do a 10. That's why you don't ever need to do 2 14 by 17. I think there might be a couple of sites. Yeah, some sites might require you to do 2 14 by 17 if that's the case, and that's what you do.
Yeah, because you only have one cassette size.
Oh, you only have one cassette? Oh,
Yeah, we
okay.
have one.
Me too.
We only have one CR room, and that's in Floro.
Okay. So then, but then you collimate. So.
And we're doing this leg, right? So
Yes.
I just need to move the
And
table.
you already
Right?
have her, yeah, not, she's nice and straight. She's kind of lined up pretty close to the center of the table. Oops, sorry.
Well, if we were doing that leg,
There we go.
so
Okay, make sure your collimate, you're open all the way. There you go, that way, okay. Okay, so now you just kind of want to, like, see how I said use this positioning line to make it like be your pretend femur. Okay, so just make sure that's nice and centered. Again, for this one, you might need to internally rotate that 5 degrees. I don't know, yeah, she does. She needs a little bit right like that, just a little tweak, so that you get these in that same position you have for the knee. Okay, have this going like this is going nicely right up her center of her leg. So all you need to do is come inside to side and shield, and make sure you got your marker. Don't come in, don't mess with the length. You want the length all the way open, side to side.
I just want to make sure my shadows are in there, right?
Well, remember,
So
like,
much.
do we
That's
need to
fine,
worry
I know.
about flesh? No, remember, bone. You can come in. You can cut off that flesh a little bit. Because also, do we need it
You
on
hear that,
here?
Abby?
We don't
Cutting
need
off
it
some of
on
your
this
flesh.
part. Okay, so,
That'd be nice.
okay, good. And if you can have them, because we kind of would
She
rather
can
not
have 'em
have
move.
that there. Okay,
There you go.
and make sure you shield up here. Okay. Marker
Marker,
and done.
marker, and done.
Boom. Okay.
AP distal femur.
All right. And if we were doing the proximal,
Just move
we
the
just move this up. You'd switch out
so
your
the
cassettes.
aces.
top of it,
Nice.
make sure that you got that. But also, now if you're doing 14 by 17, that's all you would do. Okay. If we were switching to the 10 by 12 up here, which it's nice to do just because you don't need to do all that on your patient. All that. Okay. Again. This one, now you might need a little bit more rotation to get this part AP, okay? And that's all you do. And make sure you're shielding, okay?
That's the proximal.
That's proximal, okay? Alrighty. Okay, so now the laterals. Okay.
Lateral, proximal.
Lateral, we have to do both. So we already, since we already had it set because we had we just did the AP one. All right, so we know our cassette, if we're doing the 10 by 12, which we don't have a 10 by 12 in here, but we kind of put that at the top. Just keep that close by.
What happened to that?
They're being efficient. They're putting it
right. We're good students.
Okay. Mm. And for this one on markers, you can mark in the cassette or mark in the light. Probably it's easier for you guys just to mark on the table in the light, just so you're not in anatomy. Now this is the one, like remember I said they want you to try and get this straight. That's the way the book says to do it. Now that's kind of a little hard to do, and like you'd have to have her move your... Oh, just move your, no. Kind of move this, there we go. I might just scoot you over. Okay, so if you can do that to be like, perfectly perfect, have nice straight there. Probably want to come down a little bit this way just to make sure we don't cut that off. That would be ideally how you'd want to do this. But a lot of times that's not going to happen, okay? It's just going to be real hard for your patients to do that. You're going to be, if you have a large patient, you don't want to hurt your backs moving the patient around, okay? Because that's not good. And you have to do this for a lot of years, you hope, right? So just do the best you can on that one. Get as close to this way as you can, all right? This is perfect. In a perfect role, in a perfect setting. To me, that's not the most important thing. Just make sure you're in the lateral, make sure you're not cutting off that joint, make sure you're shielding, lined up. That's the super important stuff, okay? All right, makes sense. All right, so then going down to the distal, switch them out. Like if you can try and shield up here, but so often when you do that, like see how if you come over here and you shield this part, that could be covering up that joint right there. So that's why it's real tricky to try and shield this leg, unless they happen to be like super flexible and or have wider hips and they can get that really out of the way. Then go ahead and shield it. But if not, just shield up here, okay?
From here, we would just move the table, right?
Exactly. Like you're thinking. Okay. But remember, keep your cassette out. So all you have to do is look to bring that knee, the end of that, because right now you're collimating for 10 by 12. So don't go by your light, just go by that. Okay. Now
a little bit more, maybe. Oh.
Yeah, you can. Don't be afraid to do that. That's fine to do. Because sometimes it is hard to judge when you're that far away. Okay, you can just open your length up. Your width was okay.
I opened everything up.
Yeah. Again, keep the length. Don't mess with the length. Just come side to side. Yeah. So just remember, use that line. Like that's for femur. Okay. Actually, she's probably more. Femur's probably more. That, okay. All right, and then just try and get that. without have her do that without doing that. Okay, you saw how she just rolled back. Okay. There we go. And so now we can put it back again because we just. And now see the light's coming on. And then you can just throw your marker right there.
Why do we have an exposure hole? What are we not doing? The detox.
Oh, the green lights. There.
There it
You
is.
just didn't
Bam.
know. It's like, yeah, I'm like, God, it looks right. Okay. So this one is the easy one. It's just this proximal lateral one's a little tricky. And again, the lateral knee can be. You can even have her kind of flex a little, not quite that, like right in there. That helps you to hold it a little better too, doesn't it? It makes you a little more balanced. It can kind of help.
I like the bent knee
version.
That looks very lateral to me.
Yeah. Okay. All right. Any questions?